Worcester Cares, and this evening a follow-up program, and again thank you so much for your generosity. Over $250,000 raised. That money goes right to the American Red Cross, stays right here in our community, and goes to those who were affected the most by those tornadoes on June 1st. One of the things that we've been learning about, and Derek, thank you for joining us from the health department here in the city, but one of the things we've really been learning about, Nicole, is these partnerships that you have. I guess, you know, we kind of think that all of these things happen magically. Right. You guys are preparing really every single day for if the worst happens, if something goes wrong, that you can handle it. Tell us a little bit more about these partnerships and maybe set up the one that you have with the Department of Public Health.
Sure. I think that, first of all, the key to a successful response is preparedness and planning. And we could not do this alone, as I said earlier. We stand shoulder to shoulder with all of our community partners, and we all have our little role or our niche. And it is controlled chaos, I think, when we look at it in planning a disaster and then actually moving into it. We try to put all the attitudes aside and really focus on our needs. And one of the critical needs during a disaster is volunteers, and that's where Derek's department comes in. He has a team of incredible medical and mental health professionals, both doctors, nurses, and mental health professionals that will come in, and they're part of a medical reserve corps. And they cross-train with the American Red Cross. They become Red Cross disaster volunteers so that they can fill in the gaps. If we have people in, say, 16 of our 69 towns, we need to call in Derek's teams and make sure that we have enough volunteers to respond. And this did happen during the ice storm, and his volunteers were on standby again during the tornado.
Derek, that's interesting. All right, so set that up a little bit for us. So, I mean, so these are people that you are in contact with, that you're training with, maybe not, but not necessarily on the payroll, for example, of the Department of Public Health of Worcester.
That's right. In fact, the city's Department of Public Health has organized what is known as the Worcester Regional Medical Reserve Corps. We have two coordinators that recruit, train, and prepare our volunteers to go out and assist the American Red Cross. We established an MOU a few years ago now at the Red Cross to get our volunteers in sync with what the work of the American Red Cross is doing, and we did just that on the night of the tornado. One thing we do recognize is that we're rookies when it comes to volunteer recruitment and preparation. We really rely on the American Red Cross to kind of teach us what we need to do to get our volunteers prepared. In fact, Nicole and I, on that night, we were going back and forth, and she was telling me, I think around 2 o'clock that afternoon, we're getting volunteers on standby. And so that was a cue to me to say, hey, let's contact our coordinators and let's reach out to our volunteers and see who's available, who we can put on standby, so in case of a time of need, we can deploy those individuals.
So it's really this synergy that is developed between you and all of those. Is there sort of a hierarchy, though? You talked about, you know, you have to put all the egos aside. But Derek, in a situation like that, is the American Red Cross firmly in charge?
I think it really depends, and that's really a question for Nicole to answer, but it really depends on the type of operation that is taking place within that community. There's various types of shelters, and some of the shelters the Red Cross will operate, and some of the shelters the community will operate. And depending on that operation, the Red Cross will be in charge, and other times the municipality will be taking control.
I mean, how do you figure that out, Nicole, when you're on this scene? I mean, do you defer to the selectmen or the police chief? Or?
We're there to support a community, and we, for months, years ahead, we've developed that relationship, and we know the strengths and the weaknesses of a community. The community knows their strengths and weaknesses, and we rely on the incident command system. And we will wait for the emergency manager of each town to tell us what we need, and then we'll bring in the volunteers. We will open the shelters if they do not have enough. After the ice storm, it took 72 hours to get some of our volunteers into the affected areas. So it was incredible. I think that 42 of the 69 towns reached out to the Red Cross and said, we better take shelter preparedness training so that we can open our shelters until the Red Cross arrives. So it was really an eye-opener then. Lessons learned, you talk about lessons learned. We know that we needed the mobile feeding unit. We have very large debriefings after every disaster, bringing everybody from MEMA and FEMA and each of the affected towns together to say, let's celebrate our successes, but also let's talk about what we can do to improve, and that is where the mobile feeding unit came in with both the funds from the Department of Public Health and Homeland Security. Have you begun to do that with this, or is it still too soon after the tornadoes? Right? Yeah, we're actually still, last night I was in the town of Southbridge with all the town administrators. There was a panel of 27 of us. They're community partners to listen to the needs of the community. Where are you in your disaster response phase? What more can the American Red Cross do for you? And it's really early in the stage still.
Still. Derek, walk me through from June 1st up until now, the Department of Public Health and what you've been doing and how you might be learning some lessons out of this as well.
Well, it really comes down to volunteers. I mean, there's a number of other things the department does relative to preparing for and responding to disasters, like working with our local hospitals, not even local, just regional. We have a lot of regional assets and regional coordinators that work on the DPH. And so they work with the health centers, they work with the specialty rehab centers, they work with the regional EMS, so that we have this response infrastructure for surge capacity in case there were extreme needs of individuals that need to be cared for. But getting back to the tornado itself, what we've been learning is really how to manage volunteers and how to get volunteers set up and lined up for deployment in a quick fashion. And it's something that we really hadn't exercised in the past. I mean, our MRC is only a few years old, so this is really one of the biggest events that we've had to respond to. And on that evening, within a 3 to 4 hour period, we had 40 individuals who had raised their hands and said that they were ready to be deployed.
Isn't that something? That's terrific. Now, Worcester, of course, being the largest population that the city here, when they call out for that mutual aid, I mean, that comes into Worcester, so you really have to be able to mobilize for any kind of a disaster like this, whether it's the ice storm, whether it's a tornado, or even if it's a large fire, I would think, in a neighboring community. Well,
yeah, typically, I mean, all of the first responders, whether it's fire and police, they all have mutual aid or MOUs set up with neighboring communities that they can call in outside resources if the local resources are overwhelmed. And we do that in public health. One of our regional coordinators works with the 73 boards of health in central Massachusetts. So if there's a large-scale outbreak, like a pandemic we had a couple years ago, we call on other public health practitioners to come in and help us man clinics. So, and we've learned that through fire. I mean, everything post 9/11, we've been really a response infrastructure through DPH. And so we're taking lessons learned from fire and police because they've been doing this for decades.
Terrific. I want to thank you both for coming in. We're just flat out of time, but we do want to remind people that if you have the opportunity and you have not yet given, please visit the Red Cross website and you can click right on that front page and be able to give that way. And thank you all to so many of you who have given generously.
Baby, I'm amazed the way you